free to share or direct them to our website in the link. So with that said, welcome everybody. I'm going to just show my video for a quick second so you can put a face with a name. Good afternoon. My name is Karen Lee Harrington, and I am the Executive Director of the Maine Health Data Organization. And I want to welcome you all here today or this afternoon to join us for a discussion around Rule Chapter 570. Just a few housekeeping things. One, if you could mute your phones or your computers during this session, that would be great. And submit your questions via the webinar chat. We will try and respond to questions at the end of this call. And for those that we need some time to either think about or it makes more sense to respond in writing, we will do that and post the responses on the MHDO or in the MHDO prescription drug price data portal. And as I mentioned, a recording of the webinar and I think somebody just sent in a chat that they're having difficulty hearing. Is anybody else? I don't know how we can do this easily. Leanne, can you hear?
I'm able to hear you.
Okay. And I think somebody just sent in a chat. A couple of people are saying they can hear. So for the person that can't hear, you might want to check your audio. Okay, so just quickly, we are going to talk about MHDO's mandate, review the requirements in Chapter 570, which is the Uniform Reporting System for Prescription Drug Price Data Sets rule. We'll talk about the timeline associated with the requirements in Chapter 570. We'll run through a demo of our prescription drug pricing portal. And then take a look at some resources that are available for you. And then, as I said, answer questions that we can at the end of this call, or we will respond to questions in writing. Next slide. So before I get into this, I should also mention there are a couple of folks on the call on my team that are here to support this conversation and the follow-up. And one of the individuals is Philippe Bono, who is the compliance officer. I think many of you might know Philippe, as well as Leanne Candora, who works for our data vendor, Human Service Research Institute, and she is driving right now the presentation, and we are going to tag team. So I'll be turning this over to her shortly, and she'll walk through some of the requirements as well as do the demo of the portal. So just quickly, the Maine Health Data Organization is required by public law. You'll see the reference there to collect pricing component data from prescription drug manufacturers, wholesale drug distributors, and pharmacy benefit managers. And pricing component data that as defined in the statute, and you'll see the section referenced 8731, section 4, means data that's unique to each manufacturer. And I'm not going to read all of this because otherwise we'll be here forever. But the key point that I want to make is it is data unique to each of these entities. And that it is information that helps us better understand the structure around payments and any price concessions that are part of that. And in order to take this information in a uniform way, we have to develop a rule so that we're all on the same page with what definitions are and what the submission requirements are. And that rule is, next slide, Chapter 570. So this is a major substantive rule. The difference between a major substantive rule and a routine technical in state government in Maine is that a major substantive goes before my board of directors, and they provisionally will adopt a rule, and then it goes to our legislative committee of oversight that does the final adoption. And we have gone through that process with this rule now a couple of times. And I won't get into all of that unless people have specific questions. I'm more than happy to talk offline. But as time goes on and you learn more, and we understand from you all what works and what doesn't work, we have the ability to fine tune the rule through the rule making process. The rule lays out the filing of pricing component data, and it includes information on the identification of the organizations that are required to register with MHDO and report, the establishment of requirements for the content, format, method, and timeframe for filing prescription drug price data, and then the establishment of standards for the data reported, and then, of course, the compliance provisions. Next slide. One of the sections that I wanted to underscore, because this issue has come up in the past, is the confidentiality provisions that are in Chapter 570. And these provisions are aligned with the confidentiality requirements in our statute. But essentially, information provided to the MHDO as required by this chapter by the parties, the manufacturers, the wholesale drug distributors, and the pharmacy benefit managers is confidential and not a public record under Title I, Chapter 13, except that the MHDO may share information as bulleted out in A, B, and C. And the note that I want to underscore here is that our data submissions through the MHDO portal are secure. Please do not send us data submissions through email, as email, as you know, is not. So and most of you do this, and I thank you and appreciate it. But for those of you that have sent us emails with your data submissions, please do not do that. We are, just as you are concerned about confidentiality, so are we, and we want the data sent through our secure portal. Next screen or slide. So Title 22, I want to sort of connect the dots, because one of the things that makes me crazy is to collect data just for the sake of collecting data. We don't have time for that, nor do the data submitters. And so we want to make sure the data that we're collecting is data that is being used to help inform conversations at the legislative level, within our governor's office, or other entities that have been created by the legislature, like Maine has a pharmacy accountability board, similar to other states. And so it's important that we are using information, and again, protecting what is confidential, but using information in a way that can help inform some of these conversations. And so under the law, beginning in January of 2020, MHDO is required to produce an annual report using the information that's coming through in Chapter 570, specifically on the trends in the cost of prescription drugs, analysis of manufacturer prices and price increases, the major components of prescription drug pricing along the supply chain, so on and so forth. You'll see what's bolded there. And so I just wanted to, for those of you that are not aware of that, connect the dots, that we are using this information, again, protecting the confidentiality as required, and we're also using it to fulfill the mandate of producing an annual public report. And the link in the deck, and we'll make this deck available on the MHDO website, will take you to the report if you have not seen the one that we just recently submitted to our legislature. Next slide. So just to be clear, there are registration requirements, and that action per the rule is required annually by January 30th. And if your organization has not previously registered and you need some help, please do not hesitate to reach out to our help desk. Next slide. A few notes around registration. So again, this is based on the experience now that we've all gained together over the last 4 years, and it's hard to believe we've been doing this now for 4 years, is number one, manufacturers that do not sell the WAC, or for which no products are distributed in Maine, are not subject to the requirements of Chapter 570. Virtual manufacturers that are not doing business in Maine must be registered in the MHDO portal. as manufacturers and not wholesale drug distributors. And again, we'll make this deck available so you don't have to take crazy notes. You'll have all this information available. Next slide. Wholesale drug distributors that do not distribute prescription drugs in Maine are not subject to the requirements of Chapter 570. And in the same vein, pharmacy benefit managers that are not managing prescription drug coverage in Maine are not subject to the requirements. Next slide. And a few other points here. Additional entities that are not required to register and report under Chapter 570 are listed here. Manufacturers or distributors of medical convenience kits or medical equipment only, registered 503B outsourcing or compounding facilities, contract manufacturing only, manufacturers of unfinished drugs, manufacturers and distributors of medical oxygen, nitrogen, specialty gases only, manufacturers and distributors of prescription drugs that are for veterinary use only, charitable organizations, and third-party logistics companies. Next slide. So and I don't know, Leanne, if I'm turning it over to you here, but essentially this is a screenshot, I think, of when you get into the portal, what the part of what the registration looks like. And there's the requirement that confirmation of the company's summary information, company users, and user information is required for communications from the MHDO and should be updated as often as needed to maintain timely, focused communications. And so I think here I'm going to turn it over to Leanne. But before doing that, I just want to make one quick note. And I want to acknowledge and thank all of you for the data that you've been, for the registrations that you've all done, and for the data, if you're being asked to submit pricing component data, for those of you that have been submitting it. I know whenever we do something new, there's some learning curves for all of us. You guys know better than we that this is complicated stuff. And we really do appreciate your attention to the rule and your compliance with the requirements. And for those of you where we still have, some either outstanding issues or whatever it may be, again, we are happy to discuss those things one-on-one. But I'm really happy to say that for, over 98% of the submitters, the data stream and what you're submitting is great, as is compliance with the registration requirements. So I thank you for that. So with that, I'm going to turn it over to Leanne to walk through the next couple of slides.
Great, thank you, Karen Lee. And as Karen Lee mentioned, I'm Leanne Candora. I'm with Human Services Research Institute. We've been partnering with MHDO for over a decade to help with the secure submission of data to the Maine Health Data Organization. And we've been really happy to be able to work with everyone for a few years since this new requirement came in place with the state of Maine. The next few slides are going to be just walking through some dates that were in the past, and just a reminder, if some of these items you're not familiar with, I'll also give a demo in the portal just around registration and user management, in case that you haven't been able to complete some of these steps. But a lot of these will just be reminders of things that happen every year. And so the first was that no later than January 30th, that MHDO posts on its publicly accessible website indices that hit the 1-year trigger during the prior calendar year. And I can also just give, when I go into the demo of the portal itself, I can just also bring up the MHDO website just so people know exactly where to go for that information. And then on or before February 15th, the MHDO produces and posts a list of drug product families for which it intends to request pricing component data. And then no sooner than 30 days after the publicly posting of the list, MHDO notifies reporting entities via email whether or not the pricing component data is required. And so that is the place that we're in now. On Monday, we will start sending out information and templates that need to be filled out. And we'll go through some detailed timelines related to that. So if you are required to submit data to MHDO, the pre-populated template will be available for download next Monday, March 18th. You'll get a notification, and you're asked to complete the template within your own environment, and then, as Karen Lee mentioned, to submit the completed template by May 17th via the portal, and to not send that via email. And so as part of the demo in a few minutes, I will show you exactly where and how that action takes place within the portal to make sure that you're able to successfully meet these requirements. And so this is the timeline I had just mentioned, the MHDO prescription drug price portal, which I'm going to go to, that the registration is to be completed by the end of January. Public posting of the drug product families, which it intends to request price and component data from. And then right now we're working on getting those templates ready for the 18th, and they're due in May. And so, as some of you may be familiar with, the pricing component data templates are going to look very similar to what they did last year if you had a requirement to submit. It'll be an Excel document with some instructions. It is very important that you don't add information into the templates, adding tabs, rows, columns. We take in these data and we are validating them, so we require a standard format, and so it's used to the format that's in the template. So please do not modify the template. Your submission will be rejected and you will have to redo it. So the criteria for NDC inclusion, so this is how the NDCs got selected to meet the reporting requirement this year. So what we did first is we calculated as having a top 25 NDC that is the most costly, most prescribed, or had the highest year-over-year increase. And the year that we were using was the fiscal year July 1st, 2022 to June 30th, 2023. If it was one of the top 25 NDCs with the highest average per member out-of-pocket costs for the same period, or if the pharmaceutically equivalent had with the same package size as an NDC described above. So these were our selection criteria for inclusion on the list. So in previous years, there was a manual review of the data submission, so those templates, and we coordinated with reporting entities to verify information that did not fall within our expected parameters, or where there were some corrections. We are systematizing some of these data quality processes, and what that means for you is that we will be able to provide feedback back to you as a reporting entity more quickly than previous. So I think previously, if you submitted your template, it may take a few weeks to hear back if there were issues with the data that were submitted. And so that will be a much quicker turnaround this year. And we're also working to integrate more of those results into the portal itself. So there will be more to come as we get closer to the submission deadline for the templates about how that will work. But the goal is to ensure a quicker turnaround on the data quality feedback that is more automated. So we just wanted to talk about some common issues that have been encountered. And so we're just hoping by sharing some of these issues now will help prevent them occurring in the data being submitted this year. So the first is to make sure that you are waiting for your template to appear in the portal on March 15th or March 18th, sorry. And to not create your own based on maybe one that you had available to you last year. So wait for the one that we're providing you. It should be populated with all the information you need. Do not create your own. The next is that the data is not provided for one or more of the NDCs on the template. It needs to include information from all of the NDCs and do not delete records or fields, even if values are not applicable. Please enter 0. Sometimes we've seen duplicate validation or duplicate financial values across multiple records. Data should be provided for each specific NDC individually. And then we've also seen that data values are not provided for one or more of the NDCs in the columns. And so again, please provide missing values for the specified fields. And if they're not applicable, enter 0. All right. So here are some of the validation warnings and some solutions. So sometimes the pharmacy reimbursement values are greater than payments received for one or more NDCs. Sometimes we've had pharmacy reimbursement values that are lower than the WAC when evaluated per pricing unit. Sometimes the rebate payable values are greater than the rebates received. We've also seen rebate payable values greater than payments received for one or more NDCs. And then finally, rebate receivable values are greater than the acquisition cost for one or more NDCs. And so some solutions to these issues that we've encountered in validations. So they're intended to alert reporting entities to potential data issues. And in all cases, financial value should reflect amounts accrued during a reporting period, whether or not payment was actually made or received. So now is the point in the presentation where I will go in and do a live demo of the prescription drug portal. I also just want to point out a few key features on the MHDO website as part of this. And okay. So on the MHDO website, which is up on the screen, you can see this is the home page. If you want to quickly just get to the portal where you submit your information, it is right here on the right, the prescription drug price portal. If you're looking for more information about the trigger NDCs or the list of drug product families or pricing data, that is all contained on the left bar. If you scroll down, that's where that information is contained on the MHDO website. And there's also some really great information and reports that have been prepared based on the data that are submitted. So there's a section that's legislative reports and other reports where you can find additional information. And this is also where you'll find a copy of the deck and the recording from today's meeting will be posted on this website. So now we're going to go over to the portal itself. Oh, it tricked me. All right, that is still, there we go. So once you are logged in, and on this login screen, just a reminder, there's a recovery of a password. If you forgot your username or password, you can do it here. And always be sure to use the help desk if you have any questions about what you are submitting or deadlines, or if something isn't working quite right, please feel free to use our help desk. So I just want to highlight some features on the homepage. We can, if you want to edit the details of your own account at any time, you just go to your hello and then your username. It's the link that's found at the top right of the portal. This will take you to your user details where you can change your password and manage other things with your account. On the home page, it indicates which entity you're logged in under. This will be important for those users associated with multiple reporting entities to know which account that you're under. You'll also see the status of your registrations, your template submissions, and assessment requirements. So as you can see, for this demo account, we have not completed our annual registrations or submissions. So you'll see all of those requirement informations that are tailored to you as a registered entity on the home screen. And so all of that information is summarized really nicely. And if there's any messages from the account, they would also appear on this home screen. So we're going to first go to the summary page. The information displayed is the information we have pre-populated for each reporting entity, or it is the information that you updated last time that you confirmed your registration. To edit or confirm this information, so again, this is what should have been due earlier this year. And if you've already done this, you won't need to confirm again, but the way to do it is hit that link. You can edit any of the information here and then hit confirm. And now the summary is updated that the organization's 2024 annual summary data is complete. And then we ask you to make sure that you also check out all of your users that are for your entity. There's 4 different roles that need to be populated for each system drug manufacturer, or each user type must have 1 person for each of these roles, or the same person can serve in all of these roles. We just need to make sure that they're assigned. Making sure this information up to date is helpful when system messages go out that they're going to the right person. So if this is all correct, you don't need to add a user or download the list. You can go to confirm, and now it says that that's been complete as well. Again, all of this should have been done earlier this year. This is just a little bit of an update for those who may not be as familiar. Now we're going to go to the systems submissions screen. And so this will have a record of any past submissions. And then if you go to the template screen, this is where you'll be able to download a pre-populated template. As I mentioned earlier, the 2024 reporting year templates will be available on Monday. And so that's where you'll see that. If I go to the prior year, you can see that template is available to download. And you just put download and save that in your environment because this will be completed in your environment. And then when you're ready to submit, you go to submissions, you go to submit a file, and then you choose the file selected. You choose the file that you've completed. And there is file naming conventions that are very important. There's a file naming guide, there's guidance here. The file will not be accepted if it's named incorrectly. So we just want to make sure that you're able to name it and submit it. Then we have some really nice other features on the site, everything from our help desk to the compliance, which is Silvano. His information is here. We have our user manual. So that opens up portal user manual, and then a set of FAQs. So all of those are available right in the portal itself. So once you're done with all the work that you need to do within the portal, you can just hit the logout button. So that is the MHDO prescription drug portal. So now I am, is this the point I hand it back to you, Karen Lee?
Sure. Yep, I can take it. So thank you, Leanne. So just quickly wanted to remind folks of the enforcement provisions that are in Chapter 570 and that failure to file as required by the rule is a civil violation under 22 MRSA, Section 8705-A. As well as the rule that governs enforcement procedures, which is Chapter 100. Again, our goal is not to have to trigger what we can, the fines that are available in Chapter 100 to help us with enforcement. That is like the very last step. Our goal is to work with you and try and work through any issues that are creating barriers for submitting the data according to the rule. Next slide. So we had talked about resources that are available. And so we've included the link to our rules and statutes so that you can have it your fingertips, Chapter 570 and Chapter 100, the enforcement rule, the link to the page on our site with the trigger NDCs, the link to the list of drug product families, and then you'll see the other two resources that are available there. Next slide. Technical support is available in a lot of different ways. You can either call or email our help desk, and for specific compliance and assessment questions or questions related to registration, data submissions, extension requests, should all be directed to Philippe. And that is the end of our formal presentation. I've been monitoring the chat, and I think we've got one question. So MHDO is required by that statute to keep submissions confidential. Is HSRI, MHDO's data vendor, also compelled to keep submissions confidential? The answer to that question is yes. And the contract between HSRI and MHDO includes confidentiality provisions. And they also sign an MHDO data use agreement. So I do not think that there's any need from our perspective that HSRI enter into non-disclosure agreements because any disclosure would be a violation of a contract between MHDO and HSRI. I think the next question is the top 25 list being updated on Monday. And the top 25 list, if you're referring to the report that we're required to do under statute, which shows the top 25 most costly, top 25 most utilized, and top 25 drugs with the highest year-over-year increase. We are working on the update to that report, and it should be released within the next couple of weeks. The next question is HSRI independently owned? In other words, is HSRI owned by any manufacturers, wholesale pharmacies, et cetera? And Leanne, I'll let you respond to that.
Sure. So HSRI, Human Services Research Institute, we're a nonprofit, and we don't have any other organizational involvement with manufacturer, wholesalers, or pharmacies.
All right. I don't see, Leanne, do you see? I don't see any other questions in the chat.
So the question was about the template submissions. If it says unrequired for 2024, I don't believe that that information has been updated yet. That will all be updated on Monday. But the lists are posted, right? So Karen Lee, the lists on the MHDO website that we're basing the templates off of, those are available, correct?
Yes. The next question is, what actions have MHDO taken in response to data that has been previously submitted? I'm not sure I understand in terms of the actions. The data that has come in runs through a validation process. And as I mentioned earlier, I think with each year we get better with understanding the data that we're receiving, some of the uniqueness in what you're submitting, and how that works in with sort of an automated or manual validation process. We're trying to improve that each year so that you're getting real-time feedback or closer to real-time feedback from us after you submit data. So that's one action. And then, of course, we are using the data as required by law to produce our annual transparency report. And so, again, we provided the link to the most recent report that we submitted to the legislature. And if I'm remembering correctly, it is our year 4 report. So there are 3 other reports prior to that, annual reports that we have developed and submitted. The next question is, I'm wondering if the data has been helpful to MHDO. Yes, it's allowed us to produce the reports that we've been producing. And the feedback that we've heard from entities that are reviewing those reports is that it's helpful. But I'm going to just say this, and you all know this better than I do. It's complicated, and there's a lot to it. And so our report is dense. And I think it's challenging to take this information and put it in a way where people understand it. And so that's just a constant process of trying to get better with what it is that we're trying to report on and fine tuning that so that we can fine tune what we need you guys to submit. Because again, I have no desire to ask you to go through this administrative process of sending us data that we're not going to use to help us, whether it's internally better understand things or what we can then turn around and externally report. So you have my commitment, and that's the position of my board as well. We're very committed to, again, not asking for data just for the sake of it, but you also have to recognize I have a law that I need to comply with. So trying to find that balance is what we're always working towards. And what we did in year 1 versus what we're doing now, there are differences. And it will continue to evolve as we better understand and we continue to use the information to help inform policy. So let's see. Oh, I love this next comment. Thank you for answering my questions. Thank you for this presentation. You're welcome, and thank you for attending. And then the next thing was, will the presentation be emailed to all attendees? We were not going to email it. We were just going to post it up on our website. So hopefully that will be acceptable. And if it's not, just shoot us off an email and we can send you an email version. All right. Leanne, did you see anything else?
No, thank you so much. And yeah, you can always, if you do want something, please feel free to reach out to the help desk. And they can provide you a copy. But like I said, and Karen said, it will be up on the MHDO website. And we're excited to get the templates out on Monday.
All right. So on that note, again, thank you everybody for joining us this afternoon, taking this time. We really appreciate it. for your attention to the registration requirements and the submission requirements. If you are required to submit, don't hesitate to reach out to us with questions. And we look forward to a new year's worth of data and working on our next annual report. So with that, I hope everybody has a good rest of your afternoon and take care.